So how do we start? How do we start an examination generally? Okay. First thing is your introduction. Second thing is we are talking about the examination in a short case. When you are given the command in a short case, examine the neck of this patient. In the case of thyroid, the command is examine the neck of this patient and do the relevant examination. So this is the complete command. So you will examine the neck of the patient, this thyroid swelling, and the relevant systemic examination, which is part of the thyroid examination. After the proper uh, introduction and consent, then comes the proper exposure. Exposure is very must. Whatever area is being examined, you ask the examiner, you demand the required exposure. Sir, I want proper exposure from this area to this area. That is very important. Third thing is, if the patient is opposite gender, then we demand a chaperone. Like me, I am a male examiner, patient is female, I will demand the chaperone. That is more important if you are going to examine some private parts. But in cases of like this thyroid, it is not important, but still as part of the protocol you need to demand the chaperone. After that, the sequence of the examination, the protocol SOPs of a standard examination, that is inspection, palpation, percussion, and auscultation wherever applicable. So let's start with the thyroid examination. अस्सलाम वालेकुम, मेरा नाम डॉक्टर तैयब है ਤੇ ਮੈਂ ਸਰਜਰੀ ਦੀ ਟੀਮ ਦਾ ਹਿੱਸਾ ਵਾਂ। ਮੈਂ ਤੁਹਾਡੀ ਗਰਦਨ ਦੇ ਵਿੱਚ ਜਿਹੜੀ ਗਿਲਟੀ ਹੈ ਦਾ ਮੁਆਇਨਾ ਕਰਨਾ ਹੈ। ਮੇਰੀ ਕੋਸ਼ਿਸ਼ ਹੋਏਗੀ ਕਿ ਤੁਹਾਨੂੰ ਘੱਟ ਤੋਂ ਘੱਟ ਤਕਲੀਫ ਹੋਏ। ਠੀਕ ਹੈ, ਕਰ ਸਕਦੇ ਹਾਂ। ਠੀਕ ਹੈ ਸਰ, ਆਈ ਨੀਡ proper exposure of the neck till nipple levels and a chaperone. So you will demand this from the examiner. Then the examiner can tell you that yes, you can proceed with socially acceptable exposure. Means just expose the neck up to the clavicles. No need to expose till the nipple levels. There should be thorough proper inspection from each side. From the front side, look at the swelling. Then from the sides, notice the dimensions of the swelling, its nodularity, its extent. After you have inspected this swelling completely from front side and on right and left side, then keeping in mind that this swelling is present over the anterior part of the neck, so you have this suspicion in your mind it might be the thyroid swelling. So what thing comes next? Swallowing, deglutition test. So any swelling which moves with deglutition, that is thyroid swelling or thyroglossal duct cyst or pretracheal prelaryngeal lymph nodes. Any swelling which is attached to the trachea or larynx, it will move with deglutition. Obviously, with deglutition there is movement of the larynx as a whole. So any swelling which is adherent to it will move with the deglutition. So how will you differentiate between a thyroid hypertrophy from the thyroglossal duct cysts? First thing first, if this swelling is that much huge and large, it cannot be thyroglossal duct cyst. Thyroglossal duct cyst is small midline swelling present commonly at the level of the hyoid bone. This is the common location of the thyroglossal duct cyst. It is rare of it to be present at this level in the neck. So that is the first thing. you are confirmed it is thyroid swelling. If the thyroid swelling is small, like it is it is a nodular enlargement, right lobe or left lobe, even there is the similarity of the isthmus enlargement with the thyroglossal duct cyst. If only isthmus is enlarged, okay, then you need to differentiate it from the thyroglossal duct cyst. पानी पड़ा हुआ है, कोई पानी का गिलास यहाँ से देना कप में डाल के. So it is mandatory in examination that you give sip of water to the patient. डेग्लूटेशन करवाने का एक प्री रिक्विजिट है. हम वैसे भी करवा सकते हैं, मरीज़ को कहें कि जी जिस तरह थूक निकलते हैं उस तरह निकलें. हो सकता है गर्मी का मौसम हो, उसका गला खुश्क हुआ हुआ है या मुंह खुश्क है, तो उससे वो हो ही ना, निगला ना जाए. कमांड क्या देनी है? द कमांड शुड बी टेक द सिप ऑफ वाटर, कीप इट इन माउथ, डोंट swallow. When I will give the command, you will swallow it, and at that time you will be inspecting that swelling. ਪਾਣੀ ਦਾ ਘੁੱਟ ਭਰ ਕੇ ਮੂੰਹ 'ਚ ਹੀ ਰੱਖਣਾ, ਜਦੋਂ ਮੈਂ ਕਹਿਣਾ ਉਦੋਂ ਫਿਰ ਅੱਗੇ ਲੈ ਕੇ ਜਾਣਾ. चलो दोबारा अब साइड से एक क्लिप बना लेना इसका. ठीक है. सो दिस स्वेलिंग इज मूविंग विद deglutition. It means this is thyroid swelling. So what other things you will notice on inspection? Size, overall size and dimensions, as I did during the general inspection. Any overlying skin surface abnormalities like discoloration, scar mark of previous surgery, any visible pulsations like in the case of thyrotoxicosis, upper pole superior thyroid arteries, they are pulsatile, any visible veins, which is in the case of huge swellings, and any wound or discharge. These are the findings you will need to focus during the inspection. So there are no visible veins, pulsation, scar mark, any skin discoloration. There is this small discolored skin patch. कितनों तो है? So this is since very long, might be a birthmark. ठीक है. So after that, I will do the palpation. You will ask the patient whether there is pain in this swelling upon touch, and ask her that do let me know if there is pain during the palpation. ठीक है. ਇਹਨੂੰ ਹੱਥ ਲਾਇਆ ਜੇ ਦਰਦ ਹੋਏ ਤੇ ਮੈਨੂੰ ਦੱਸ ਵੀ ਦੇਣਾ. ठीक है. टेम्परेचर मैंने आपको कहा था कि 2 जगह से चेक करना है, फ्रॉम द बैक ऑफ योर हैंड. उसके बाद पैल्पेशन फ्रॉम द फ्रंट एंड पैल्पेशन फ्रॉम द बैक. ये दो कंपोनेंट्स हैं थायराइड स्वेलिंग के. ओवरऑल पैल्पेशन कर लें. स्किन पिंचबिलिटी, mobility from side to side, palpation of the trachea. Now there are two methods to palpate the trachea: one finger and two finger. Two finger is put your these two fingers on the sternoclavicular joints, then feel with the middle finger. And what is the second method? One finger method. So two finger method fixes the trachea at one position, then you can feel it easily. For this huge swelling, to palpate the trachea, again offer the sip of water to the patient. मुंह च रखना है. ठीक है. जब ये डिग्लूटेशन करेगी यू विल फील द ट्रेकिया. चलो कुट परो, तो वो स्वेलिंग अपवर्ड्स लिफ्ट होती है एंड इट इज़ इजी टू पैल्पेट द ट्रेकिया. इसके बाद क्या फील करना है? कैरोटिड्स, बाइलैटरल कैरोटिड्स. एडम्स एप्पल को फील करें. इससे जस्ट लैटरल बिटवीन द स्टर्नोक्लेडोमास्टाइड और आपको कैरोटिड की पल्सेशंस फील होनी चाहिए. What is Pemberton sign. Very good. For huge swellings, Pemberton is done in case of huge swellings. छोटी swellings पे नहीं करते. Patient is asked to raise her upper arms along the ears. First demonstrate it to the patient. इस तरह करना है, ऊपर दोनों बाजू कन्ना दे नाल लाने हैं और यहाँ से प्रॉपर एक्सपोजर होना चाहिए. यार नीचे कर लो ताकि सानू नज़र आ जाए. ठीक है, चलो हॉर्न ऊपर कर लो बाजू. Look for the venous engorgement, facial congestion. साथ नहीं उखड़ रहा. नहीं. Another test is Coker's method. Coker's test क्या? What is Coker's? It is to rule out the tracheal compression. If this huge swelling is compressing the trachea, then Coker's will be positive. What do we do in Coker's test? We press the swelling with one hand and listen the breathing of the patient. If there is hoarseness, change in breathing pattern, it means that it is overlying or compressing the trachea. सांस लो लंबे लंबे. So in this case, Coker's is negative. Now palpation from behind. What is the purpose of doing palpation from behind? No, we palpate the gland in detail, its nodularity, its surface, its extent, and posterior surface. Fix one side with one hand and palpate the other side. Now I am palpating the surface of the gland for any nodularity. I am checking the surface of the gland. Even I am able to palpate the isthmus separately. Then press the opposite side with the opposite hand and palpate the other side, its nodularity, its surface. Then how to palpate the posterior surface of the gland? Press the opposite lobe with one hand in such a way that the opposite lobe is displaced off midline. Then its posterior surface can be palpated from this side, its nodularity and extent. Similarly, press like this and palpate the posterior surface from this side. It's called Lahey's method. Laheys, Lahey's method, to palpate the posterior surface of the gland for its nodularity, surface, extent. What if the patient is having short neck? How will you examine the thyroid gland, palpate the thyroid gland? You ask the patient to keep his or her hands behind the neck and extend the neck and put force on the clenched hands against resistance so that the gland becomes prominent. So that way you can palpate the gland easily. Okay, but in this case it is easily palpable, so no need to offer the Pazillo's method. Next step is the palpation of the cervical lymph nodes in case you are suspecting a thyroid malignancy. So starting from the submental lymph nodes, submandibular lymph nodes, then the cervical lymph nodes. How to palpate the cervical lymph nodes? One side at one time. Ask the patient to slightly flex the neck to the ipsilateral side, then palpate the upper cervical lymph nodes, middle cervical lymph nodes, and lower cervical. Repeating the same steps on opposite side, upper cervical lymph nodes, middle cervical lymph nodes, and lower cervical lymph nodes. What are the levels of cervical lymph nodes? This is level 1A, level 1B, level 2, level 3, level 4. Level 5 is pretracheal prelaryngeal midline. Level 6 is posterior triangle. And level 7 is upper mediastinal. So here the palpation is complete. Now I will do the percussion. Percussion किस चीज़ की करते हैं? what areas are percussed, and why the percussion is needed. For retrosternal thyroids, if you are suspecting in this case that this patient is having retrosternal extension of this thyroid, then you will percuss the upper mediastinum. If it is dull, then it is confirmed that it is having retrosternal extension. But as in this patient, the trachea is palpable. I am not suspecting retrosternal extension. I can omit this step. You can ask the examiner, sir, as the trachea is palpable, it means it is not extending retrosternally, so I am omitting this step. So you can tell him at the end of the examination. But just for the purpose of understanding and teaching, I am demonstrating you that how to percuss for the retrosternal thyroid. Feel the suprajugular notch. Then first percuss the upper lobes of the lung in the intercostal areas to have an idea of the percussion note difference. So it is same note, same percussion note as it is here, same is here. So it means there is no retrosternal extension. So after the percussion, we will auscultate the gland. Stat थी आपके पास. What area you will auscultate? If you are suspecting and you didn't feel the carotid pulses during the palpation, then it means there is compression of the either compression of the carotid vessels due to huge thyroid gland, or it is displaced, or there is engulfment, encasement of the vessel by a thyroid tumor or malignancy. In that case, you can hear a bruit over the carotid vessel. Bruit is heard with small diaphragm. You can also listen the precordium area in case you are suspecting that the patient is thyrotoxic. बस ठीक है इस तरह रहेंगे. So here the examination of the thyroid gland itself is complete. Now the command is do the relevant examination also. So what is the relevant examination of the thyroid swelling? To check the signs of hyperthyroidism, thyrotoxicosis. What are the signs of thyrotoxicosis? Starting from hands, fine tremors. Then what is the ideal environment or method or protocol to take the pulse? It should be resting and sleeping pulse. That is the ideal environment. When the patient is sleeping and is at the state of rest, then take the vessel, because patient might be in the state of anxiety, and I can feel the tachycardia, she can have the tachycardia, and we should take complete 1 minute pulse. So the patients having thyrotoxicosis, they have palpitations and tachycardia. Another thing to check in the hands is the palmar sweating in case patient is thyrotoxic. Heat intolerance. So how to check the fine tremors in hands? Fan should be off. First thing first, fan should be off. Then hands spread like a fan. पेपर दो एक, उंगलियां खोल लेनियां ने. देयर आर नो फाइन ट्रेमर्स. जो फाइन ट्रेमर्स होते हैं ना पेशेंट को, वो इस तरह होते हैं, ठीक है, वो ऐसे आ रहे होते हैं. उसके बाद हेयर टेक्सचर, टेक्सचर ऑफ हेयर चेक करते हैं. कोर्स टेक्सचर किस में होगा? इन हाइपोथायराइडिज्म देयर विल बी कोर्स टेक्सचर. देन द आई साइंस. what eye signs you will check for? If the patient is having thyrotoxicosis due to multinodular goiter, or there is a nodular swelling and patient is having thyrotoxicosis, means there is not diffuse enlargement, it is not Graves' disease, then you will check only two eye signs, that is lid lag and lid retraction. But if it is Graves' disease, there is diffuse enlargement, antithyroid receptor antibodies are positive. In that patient, you will notice all the eye signs: proptosis, lid lag, lid retraction, Mobius sign, Von Joffrey's sign. All those signs will be positive in a patient with Graves' disease. If the upper white sclera of the patient is visible, it means it is having patient is having lid retraction. Hold the head and ask the patient to follow the finger. Check the upper lids. They are equally moving in equal speed with my finger. But what happens in lid lag? My finger will be going down, and patient's upper lids will be staying behind. They will not be following my finger direction or finger movement नहीं है. चलो ऊपर उठाओ ज़रा, जोर लगाओ, बस ठीक है. In this patient power is 5/5. Then we can check the ankle jerk. ਇਹਦੇ ऊपर रखना है ऐसे. First check there is no joint restriction. पैर ढिला छड़ दो. You hit here and feel the contractions there. ठीक है. If there is sharp jerk, it is present in the thyrotoxicosis. चलो ठीक है. At the end say thanks to the patient, cover the patient. चलो बहुत शुक्रिया तामन दा तुहाडे. ठीक है, कल तुहाडा इंशाल्लाह ऑपरेशन हो जाएगा. So here our examination is complete.